All right, everybody. Thank you for coming tonight. We're going to go over a lot of information tonight. First of all, I'm Dr. Brent Beacom, along with my wife, Dr. Helena, and Dr. Nate. We run the office here, all right? So tonight I'm going to go through a lot of information of what chiropractic is, what it isn't, why we do what we do, what you guys can do to help yourselves live healthier lives and make what we do more effective and efficient for you guys, okay? Basically, we're going to start out by asking, why do people go to a chiropractor? Why would you go and show up to a chiropractor? And it's the same reason you would go to any doctor ever. Something not working, right? Something hurts. And in our realm, it's something, my back hurts, my neck hurts. It can be conditions that maybe you don't know a lot of why chiropractic can help with, things like asthma, infantile colic, stomach disorders, okay? Whatever the condition somebody comes in for, you got to understand, if you come in to a chiropractor and you're like this, and you go through a bunch of care, and you start feeling a little bit better, who wants to go back that way, right? And it's no different than if you brush your teeth, exercise, eating good foods. Once you start feeling better, once your body starts functioning better, it doesn't make sense to stay there. It doesn't make sense to put in a little bit of effort at that point to keep your body working in a good fashion. And that's where a lot of our practice members actually get to, and they stay here for a wellness level, a maintenance level, to keep their bodies working well, okay? And I'm going to go in tonight why we believe that's important. Does everybody choose it? Absolutely not. But at least hope by the time we're done tonight, you'll have an idea of why that's important for you. So, when we talk about living healthier lives, we have to define it. And I challenge you to ask all your doctors, any doctor you ever go to, this question. Hey doc, can you define health for me? And watch their reaction. Now the definition we use here, I didn't come up with it, it's the World Health Organization, Dorland's Medical Dictionary. It says that health is a state of optimum physical, mental, and social well-being, not merely the absence of disease or symptoms. Yet in our world, in our country, what do we focus on? Well, we're healthy until we have symptoms. That's not true, because how many people do you know maybe have a heart disorder? Healthy as a horse, the runner's 45 years old, eat a good diet, boom, fall over of a heart attack. And that's a common story that happens. Well, obviously they weren't healthy on the inside, they just weren't expressing symptoms yet. This is about being at our best, physically, emotionally, socially, in all our relationships. Your mom and dad ever say, hey, you know what, just be average. It's silly, right? We want to be at our best. Now, if we're going to be at our best, we have to reach this next definition, which from Webster says health is a condition of wholeness in which all the organs are functioning 100% of the time. So the two key words, wholeness and function. We have all our parts, and all our parts are working the way they're supposed to. Okay? I know that sounds logical, it sounds simple, but in the medical realm, if you start thinking about it, if your gallbladder doesn't work, they take it out, now you're not whole. Back in my day, if you had a sore throat, they took your tonsils out. I remember my older sister, they actually sent her tonsils home in a jar with her. Okay, yeah, I know it was gross back then. Now, it's not to say that those things aren't necessary from time to time. But the way I look at it is we're given all these parts for a reason, and they all work together to help our bodies work at their highest level. Everybody's heard of Grey's Anatomy, not the television show? I know you're thinking about it. Okay, this is the Bible of all anatomy books. And on the very first day of chiropractic school, teaching our philosophy class, Dr. Virgil Strang, he comes in and he says, gang, in here it states that it's the purpose of the brain and nerve system to control and coordinate the function of every cell, every tissue, and every organ in our body so our body can adapt to the environment around it. The purpose of our brain and nerve system to control everything that runs our body. So if we're going to have proper function 100% of the time so all our organs work, and we can reach that optimum level of physical, mental, and social well-being, isn't it important that we have our brain and our nerve system working right? And that's where we come in as chiropractors. Because I get and I understand that most people out in the general public just look at us as back pain doctors or neck pain doctors. Man, if that's all you want to box chiropractic into, yeah, let us serve you that way, but I think you're being very limited when it comes to thinking about your health, okay? What we work with is what we call vertebral subluxation. And you guys are all patients here, you've heard us use that term. But what a subluxation is, and I'll get into more detail in this a little bit later, is simply where those bones shift a little bit And when those bones shift a little bit, that interrupts the way the brain talks to the body. Whatever the symptom is, whether that symptom, whether those pains, whether it's pain, whether it's organ dysfunction, your stomach doesn't work, whatever it might be. When we have subluxation, we don't function at our highest level. And our job is to correct and get rid of that. Now, chiropractic is three things. It's the science, the philosophy, and the art. Science is the science, and I'll tell you, anybody that ever tells you there's no science in chiropractic, I got time. Have them come into me. I got science from 100 years ago that is valid today. We got science that shows the weight of a dime's worth of pressure on a nerve will decrease that nerve's conductivity by 60%. So if those are nerves that are going to your lungs, and your lungs are only getting half the messages from the brain that they're supposed to be getting, is that a good thing? Not really, right? So people that say there's no science just haven't looked for it. Okay? It's there. But science, as we do it, our clinical science, is simply how we evaluate for subluxation. So it's doing our exam, it's looking at our x-rays, it's evaluating for the areas of the spine that might be damaged. The art of chiropractic. My little daughter's an artist, and she's 10, and she's cute as a button, I think, and I love her art, but some people might not like it. Art is art. If you guys have ever been to different chiropractors, we all do things a little bit different. Within our office, myself and my wife and Dr. Nate, we all do things a little bit different. It doesn't make one of us right and one of us wrong. And this is a point that I want everybody to go out of here with tonight. I'll hopefully make a few of those for you. Number one, if my art doesn't work for you, if my styles and techniques of chiropractic do not work for you, try my wife. If hers don't, try Dr. Nate's, because what we have here is a cool blend of some different niche approaches to adjustments, okay? And if none of us work, go find another chiropractor that does, because the principles of chiropractic that we're going to go over tonight, I'll defend these till my dying day, because they're absolute and they're right. And I love it when science and logic come together. But if you don't like our style, go find somebody whose style you do like. Okay. Nothing gets my goat more than, oh, I went to a chiropractor once and it didn't help me. Yeah, well, I went to a dentist once and I didn't like that dentist. I did not go to another dentist ever again. It's silly when you put it in those terms. So find the artist, the chiropractor that works. Because chiropractic, the science and the logic behind what we do is absolute. Now the philosophy of chiropractic is one of the coolest things. And this is what got me into this realm. Many of you may know my story, maybe you don't. I grew up in a town of 800 people in the Upper Peninsula, and the only two doctors we had were a dentist and a vet. Didn't know anything about chiropractic growing up, all right? I did what most people do growing up, and you go to the medical realm because that's what you're taught to do. Go to the doctor when you're sick, when you got symptoms, and only when you got symptoms. And you get medicines and you get treatments that way. And I didn't find out about chiropractic until I was a junior, after my junior year at Elm College. And I just had all my anatomy classes and physiology classes, and I was smart then. I was book smart. and I met a guy. I met a chiropractor in Ludington. I was working on the Badger car ferry. And he was just out of chiropractic school, working for somebody up there, parking cars in his spare time. And Dr. Dave started explaining chiropractic to me. He started talking about some of the stuff I'm going to talk about tonight, about how the spinal joints should move freely, and when they don't, that pinches on the spinal nerves, stopping the brain from talking to the body. And I'll tell you, I was a cocky kid back then, and every time he made a point, I was going to debate him just because I like debating people, right? And I was just going to argue with him. And every point he made was absolutely correct. Everything he said was absolutely right with the science of chiropractic. But one of the things that caught me, he goes, Brent, and I use this all the time, he goes, Brent, God didn't make junk. Your body can heal itself as long as there's nothing interfering with its ability to heal. And in the chiropractic realm, what we deal with to help the body, to make sure nothing's interfering with the body's ability to heal, is making sure the nerve system is clear of interference. And that made sense to me. It made sense to me because I remembered when I was 11 years old and I flipped my bike. Well, a week before I'd hurt my arm, and I just thought it hurt. But flipped my bike, and sure enough, that arm was broke. I mean, it looked like a spoon. So we go to the hospital, and that one's broken. They looked at this one, and the doctor just goes, "Ooh, that's broken." They took an X-ray, and guess what? A week's worth of healing, that bone was already healing. It was healing wrong. That's the key thing. It was healing wrong, but it was healing. So the body can heal itself as long as nothing's interfering with it. when injuries happen to your spinal joints, we want to make sure that those joints are healing properly following the injuries. So, like I said, God don't make junk, man. Embryology. Whew, I could nerd out on this for days. This was my favorite class on how two single cells come together. An egg cell and a sperm cell, and they come together, and you think of that. Single cells, each cell contains half of your genetic coding. That's it. And they come together, and boom. Okay, I don't have to back up. I can skip the wine and candles portion of all that, right? Okay. So, those two cells come together, form a cell. Then they split and form 2, and 4, and 8, and 16, and so forth, until you get this glob of little cells. Eventually, that glob of little cells has to become you. When that glob of cells starts becoming a human being, well, in order for that to happen, you have to have an organizing device. Well, that's our brain. The very first cells to specialize and become what they become in our bodies is called our neural tube. So guess what? At about 3.5 weeks, you start getting your neural tube developed. Hey, a few days later, there's your heart, because the brain's telling the heart and the blood vessels to develop. A week after that, hey, you can pretty much make out that's a baby. Yeah, maybe it looks like a tadpole, but it's basically a baby at that point. In this process, 10 fingers, 10 toes, all the way through to the end of the first trimester, where you certainly, now all that loaf of bread has to do is grow. Okay? This doesn't happen by accident. There's an intelligence, a wisdom within those cells that eventually becomes who we are as people. And man can't do this. This is all nature. Okay? But where man comes in and our left brain comes in is, hey, maybe we can do better than nature can do. And we can't. Airplanes can fly, they're not as efficient as birds. Boats can go on the water, they're not as efficient as fish. Okay? Nature always does better, we try to mimic it. Man tries to improve on what nature and God have already developed. Some examples of this. Anybody in here, you may remember thalidomide, the drug thalidomide that was given to women. And remember, if you remember, thalidomide was given to women back in the 50s and 60s for morning sickness. Okay? Again, within the pharmacological medical realm, if there's a symptom, they want to get rid of the symptom. And morning sickness probably is not pleasant. Us guys keep our mouth shut. All right? Well, but it's normal. It's a normal sign that the baby's implanted in the uterus properly. And some women just react differently to others. But they came up with this drug thalidomide that made symptoms of morning sickness go away. Women slept better, they felt better, they didn't vomit. Until babies started being stillborn. Until babies came out mentally retarded. Until, and this is the one that most people remember, babies came out without arms or legs. They were called flipper children. They might have had a hand coming out of their shoulder joint or no legs, right? And after a while, and, you know, some kids whose mom took the thalidomide, they came out normal, okay? But after a while of all these complications and kids not being born healthy, they took it off the market. Said, okay, well that's done, we don't do that anymore. Here's the problem. I have a woman who's a patient whose mother was given the drug thalidomide. And my patient's perfectly fine. Great job, works at a factory in town, does great things. Her daughter was born without an arm. Because whenever mom is given a chemical during her pregnancy, it's going to interfere with this process somewhere along the line, and cell replication is going to get messed up. So now this girl is born without an arm, and now it's in the DNA coding of that whole family line that something could go wrong with all future generations. Now we don't give thalidomide anymore. What do we do to pregnant moms? Force the flu shot, force these drugs. It's okay to take these medications. And I get in life-saving, listen, when I say this stuff, I understand life-saving scenarios. But day-to-day medical process during the embryology stage is going to screw up brain development, it's going to screw up nerve development. You got to be careful, because it might not just be affecting the kids in this generation, it might be affecting the kids, their kids down the road. So be very careful of trying to interfere with a process. It's already great, man. I mean, think about this. You start getting to 18 weeks, this is about halfway through, they got pictures of, you know, babies sucking their thumbs. Who's telling the baby to suck their thumb so that they'll be able to eat when they come out? Innate intelligence, man, the wisdom we have within us already knows if we don't start developing that reflex, we're going to starve when we come out. Right? This is a pretty easy process. As long, 99% of the time, mom's healthy, eating good, exercising, getting adjusted, there's not the problems here. It's problems are when we try to interfere with it and help the process. And by help, I mean really harm. All right, brain and nerve system. So, this is the meat and potatoes, some of the science behind what we do, right? The brain is a central computer. It runs everything in our body. And without getting into neuroanatomy and neurophysiology, just know there's different parts of the brain. I don't even have a brain up here. There's my brain. I was going to say, I knew I saw it up here. Right? If I only had a brain. Sorry, I watched The Wizard of Oz the other day with my daughter and son. All right, so brain up here, very delicate organ, protected in this big case of bone called our skull. But the brain's got three major modules to it. All right, you got your brainstem. That's what the very first part of the brain to develop, the neural tube, becomes. Man, this is the most densely packed region of neurons in our body. And this is where all basal functions of life reside. This is where our heart rate center resides. This is where our breathing center resides. Can you imagine if you actually had to consciously think to have your heart beat every time, or you breathe every time, you'd get nothing accomplished. We couldn't do it. So again, the grand organized designer put all that stuff right there in the deepest part of the brain, and it just happens automatically. And so that's where, like I said, all basal functions of life are run by your brainstem. Now you got your cerebellum back here. That's kind of your hindbrain, a lot of coordinated motor muscle movement, muscle memory, learning how to swing a golf club, right? You just do it enough times, it becomes second nature. Learning how to ride a bike. I'm sure if you've ridden a bike before, how long has it been since you've ridden a bike, Dale?
25 years.
But if I put you on a bike out there, you might be a little wobbly at first, just as you got your bearings back. But you'd be able to do it because at one point you learned, and your brain stores that memory back here, and that muscle memory will come back. It's fine motor movements, fine coordinated movements are stored back in this region. Then you got your cerebral hemispheres. That's a higher brain function. That's what tells us what our personality centers are, our visual centers, our auditory centers, our calculation centers are all up in here. All areas of the brain are important, okay? We need them all integrated, we need them all working together, because as the brain sends messages down our spinal cord, and it kind of looks like that, a little more complicated than a phone wire, but it's the best representation we've come up with. The brain sending messages down the spinal cord, out the dorsal nerve roots, to the body, to every organ, to every cell, to every tissue in our body, telling it what to do, and then from the body, back into the spinal cord, back up into the brain so that computer can process every bit of information that comes through. And that loop, those nerve messages are being sent through our spinal cord, through our nerve system at 400 miles an hour every given second of every given day without you ever even thinking about it. Pretty ingenious system. And it runs you and me and Dr. Nate and everybody else. It's our nerve system and our brain that runs and controls all of our conscious thought, all of our subconscious thought, all of our function in our body. Now, again, the brain, and this you'll see these themes throughout the body. It's not just in the nerve system and in the spine and the brain, but brain being the most important organ in the body, protected by what? Our skull. Like I said, a vault of bone that protects the most important organ up here. But our spinal bones, our vertebrae, do the same thing for our spinal cord. So that main pathway of spinal nerves, those messages going down, all these bones protect it. Our ribs protect our lungs and our heart, right? I mean, this theme is throughout our body. Pretty ingenious that all our important organs are protected. Now, spine, made up of 3 different regions. Our cervical spine, our neck, there's 7 bones there. 12 bones in our thoracics, 5 bones in our lumbar spine. And then way down here, we have our pelvic structure. We have our left pelvic bone, our right pelvic bone. Then we have our sacrum in the middle, okay? And that's the foundation. Everybody's here is built something, right? I mean, a birdhouse, a cake, a house, whatever. If you don't have a solid foundation, everything else up above starts shifting. So it's important that we keep the pelvic structure sound. So with the spinal bones, to orient yourself, here's the front, here's the back, just like that sitting right there, okay? You hear us talk about spinal joints. Where those bones come together, those are the joints. And there's muscles and there's ligaments that hold them all together. In between each vertebrae, you got a disc. Now the disc is made up of two different parts here, okay? Don't worry, there's not going to be any tests on this. Maybe for you there will be. You got this outer tough ligament part and this little inner jelly part. And the purpose of the disc, provide the space for the nerves to come out of, okay? What we want to have happen is we want to have all those joints, 24 movable bones in our spine, our 3 movable bones in our tailbone, our coccyx down at the bottom. They all should be nice and gliding, nice and movable, free motion in through those areas. And what happens when we start losing that is what we call the vertebral subluxation, okay? And you've heard us say this, how many parts? You got the sprained joints. So what happens when joints sprain? Those muscles and ligaments, think of a rope, okay? All the fibers of the rope, that's what a ligament and a muscle are like. When the ligament and the muscles are holding those together and we fall down as a kid, well maybe, let's say there's 100 fibers, maybe 3 of them tear. And they heal, because again, the body heals itself, right? But maybe those fibers, when they tear, that bone just shifts a little bit. And it gets stuck. Now when you're 5, not a big deal. But if that joint stays stuck till you're 25, 35, 45, 55, now we start having problems. So when those spinal joints shift that little bit and they get stuck and they heal in the wrong position, it's those spinal nerves that get pinched on. Here's what I was saying. When people say there's no science behind what we do, oh, I knew a chiropractor, he said that he could help people with asthma. That's garbage. I hear that stuff all the time. Or ear infections, right? The weight of a dime on those nerves decreases that functionality of those nerves. That comes from a study done at the University of Colorado's medical school. Okay, 100 years ago, there was a doctor called Henry Windsor, and he was a medical doctor who didn't like the idea that chiropractors were saying that they could help people with stomach disorders or XYZ disease or ABC disease. And so he went to the University of Pennsylvania and he was given permission to do experiments on cadavers. And what he was looking for was saying, hey, you know what, if these 5 people have a stomach problem, and then I should be able to go to the areas of the spine, that the nerves come out of the spine, and find that there's a problem at that region. And with 100% correlation. And this was done, I love this, this was done 1921, 98 years ago. Right, so I love using old stuff, because stuff's been around forever. All 20 cases of heart disease, the upper 5 thoracic vertebrae were misaligned. All 26 cases of lung disease had spinal misalignment in the upper thoracic area, because guess what? The nerves from right there, and the nerves go to your lungs. And that held true with every region of the spine, every organ that had a disorder. Man, I saw this in my first year of practice, second year of practice. I had a woman who come in to my office and she had some low back pain. Okay, great, you know, let's get going. And again, I was only a couple years into practice, so I didn't understand things as much as I do now. But then she started telling me in her first visit about how she couldn't get pregnant. Her and her husband had been trying to get pregnant again. They'd had a child, they'd been trying for 4 or 5 years to have another one, they had no luck. So they start looking at, you know, in vitro fertilization, and they start looking at, you know, what they can do to have another child. And I said, hey, hold off on that a little bit. And sure enough, we took her x-rays, her sacrum was really rotated, subluxated. And after about 6 weeks of adjusting this woman, she comes into the office and she goes, oh my God, Dr. Brent, I'm pregnant, and it's all because of you! And that really freaked me out, because it wasn't. But it was simply the same thing that was causing her back pain, was causing her body not to be able to sustain a pregnancy. Because if her reproductive organs, down here coming from the nerves coming from the low back, were not functioning properly, then basically her uterus was saying, hey, you know what, I'm not going to hold a pregnancy, don't even start this. So instead of tens and hundreds of thousands of dollars of in vitro fertilization techniques, which people go through every day, doesn't it make sense to start first in making sure that the body's structurally sound? So when joints sprain and nerves get pinched and muscles spasm, and a key component is that when those joints sprain and misalign, it's 7 to 10 days. And this research was done by Tapio Vitamin. He was a researcher from Helsinki, Finland. When that joint misaligns, within 7 to 10 days of it not moving right, the body starts producing scar tissue. So like I said, those fibers of the ligaments get torn, that scar tissue starts filling it in. And think of that gum you're chewing, right? If you stuck it up underneath my desk, please don't. If you left it there for a week, a month, it's going to harden, isn't it? So in our bodies, when that scar tissue, that bubble starts growing, and it grows for 10, 20, 30, 40 years, the body starts calcifying it. So now, instead of this, the bones are going to look like this. And that's where the damage comes into play. Because the average age of somebody going to a chiropractor for the very first time is 45 years old. The average age of a child or of a person's spinal joints being sprained for the first time is birth. 85% of us have damage to our spinal joints just as we're being born. If there's interventions, it's higher. I'll get to that in a little bit. So when those joints stay sprained, obviously we're not functioning as well. I don't know how this thing works. It might work, but not like we should. It leads to degeneration. Now you've all seen this. I'm going to go into this a little bit from a little different angle because I know as practice members here you've all seen this. We break this down into 4 phases, right? And you've heard me explain phase 1, just a misalignment phase. But when you look at the phase 2, 3, and 4, this was a case study. You can see there's an A, B, and a C in there. This was the same woman over a 24-year period. And at 46, 45, somewhere in the mid-40s, she went into her medical doctor because she was having some neck pain, a little bit of tightness in her shoulder, right? What a lot of people deal with. He took an x-ray and said, you know what, yep, you got some arthritis. You know, you're getting a little bit older there, so that's going to happen. Take some Tylenol, it'll help. 7, you know what the deal is. 7 years later, she goes back to the same doctor. Now at this point, she's got numbness, she's got weakness in her hand, she's got more pain. And he goes, hey, I remember you, let's take another x-ray and see what's going on. And it had gone from where there was still some space, some mild to moderate spurring, to this in as little as 7 years. To where now that disc is completely shot. So maybe it went from that to nothing. And at that point, now the doctor's thinking. He's going, well, that's bad. Guess what they do there? They up the drugs. Now you're into your opioids. Now you're into the Norcos. Well, now she's under pain management, and he's watching it at this point. And he takes an x-ray throughout, and 24 years after that picture's taken, body had completely taken over and fused it. And at that point, now the nerve's shot, the nerve's done. At one point, this looked like this. When we're at a phase 1 level, it's when we can help the most. It's when we can do the greatest amount of good for people. By the time you get down into here, not saying we can't help, because again, I've been doing this a long time. I've seen people in all phases improve, but we're obviously going to be a whole lot more limited helping the body function that looks like this versus that, right? And that's where subluxation starts breaking down the body's ability to work right. But not just the body's ability to work right. Start thinking about how when we're physically not at our best, how that starts affecting our mentality. How it starts affecting how we treat other people. And to us as chiropractors, our goal is to get people out of that realm and feeling better and functioning better and being happier, really, for the long term. So, causes of subluxation. We always say, and here's where you have to start looking in your life. Hey, Dr. Brent, I was never hurt. Every single one of us, by the time we were 10 years old, fell down in some way, shape, or form thousands of times. Don't just watch my son for a day. I mean, it happened to all of us. But we say there's 3 things that cause damage to our nerve system. 3 things that cause damage and cause subluxation. And the easiest one to explain and for people to grasp is the physical. It's the falls. It's childbirth. 85% of us have damage just as doctors are pulling out on babies' heads. Okay? Studies done have shown that doctors will pull, and this is without forceps and without vacuum, right? But during C-sections or natural hospital deliveries, they will use force that pulls on the baby's neck that exceeds 120 pounds of pull. Now, for reference, it has been shown that at 120 pounds of pull, it can decerebrate a child, which means it's basically pulling the brainstem out of the brain, and that's kids being born stillborn. So the fact that most of us survive is a testament to how strong the body is. Okay, but it doesn't mean there's not damage done. So if those joints are sprained right at day one, right at birth, and they heal wrong, and that scar tissue starts developing, and then you fall down when you're learning to walk between 8 months and 2 years old, 100 times a day. And then you climb up the pantry when you're 3 because all the good stuff's at the top, and boom, you fall down. And then you wipe out on your bike, learn to ride your bike 55 times. All those things accumulate. What else? Sports injuries in high school, 5-mile-an-hour fender benders. This is a thing that a lot of people don't understand. Well, I was in an accident, I was rear-ended at 40 miles an hour, but I wasn't hurt. No, because in our minds we think, hey, I didn't go to the hospital, I wasn't bleeding out of all my orifices, I didn't die. And we think we're okay. But underneath, those joints are just more layers of that scar tissue damage that are building. Okay? Repetitive work. We all got to go to work. And just so you know, chiropractors aren't immune, because guess what we're doing all day? We're bent over. It happens to us. It happens to engineers. I've seen a lifetime worth of engineers in my day living in this town. Every single one of them has right-sided neck and shoulder pain. I'm sitting there and working a mouse and looking at a computer screen. That's not physically that laborious, but it's repetitive. It's working one side. Absolutely people that are lifting and twisting, absolutely people that have physical jobs, that's going to wear and physically damage the joints in our body, causing damage from early age all the way through. But that's the easy one, right? Those are the easy things to explain. I fell down the stairs, something sprained. The two other components that people don't pay a lot of attention to and how it affects our nerve system, mental and emotional stress, and chemical toxicity. True life story, 10th grade, Emily Rose broke up with me. I had a stomach ache for 2 weeks. Emotional stress causes physical problems. And we all know it. And there's stress in our world that's not going away. We all have some level of stress in our lives, right? Whether it's money or spouse or kids or friends or family. And you can't get rid of it. But if you let it consume you, if you do, then hopefully I'll give you some ideas here that can help. If all you do is focus on the stress, it's going to cause more stress, and that's going to increase nerve interference. Like I said, you can't get rid of it. I wish you could. But you can find healthy ways to manage stress. In our world, a lot of people manage their stress chemically. It doesn't make you healthy. Right? So find things to do that cause you happiness. Right? I like to golf. Go fishing. Find things that give you calm in your body. I don't care if it's yoga or going for a walk. I mean, find underwater basket weaving. Find something that gives you calm in your life every single day. Because it'll combat the garbage that we're inundated with on the news and in our world. I mean, if you listen to the news, one thing that'll cut, practical advice, shut off the news at night. We all know the world's going to hell in a handbasket. They tell us every single day. But if you're watching the news at night, the last thing before you go to bed, you got to understand our mind, it doesn't know the difference between what's real and what we think about. So if you're putting on a movie screen right before you go to bed, you're watching bad stuff, bad stuff, bad stuff, bad stuff. Guess what? When you go to sleep, your mind has 20,000 uninterrupted thoughts. And the last thing you think about is usually what's running on that movie screen all night long. So you watch the news, and everything's negative, negative, negative. You go to bed, and negative, negative, negative runs in your life. It's real easy to wake up going, oh, it's a crappy day. So instead of doing that, shut the news off. It's something I've done with my children every night since they were little. I mean, from peanut little. Lily, you're beautiful. You're kind. You make friends easy. You're funny. You're silly. You're constantly filling your head with good stuff. Okay? Why don't we do that for ourselves? Most adults never talk good to themselves. You need to have positive affirmations. My body's strong, my body's healthy, I'm happy, my body's happy. You know, at this point, do this with your kids. And your granddaughter, she's so cute. I saw her the other day, she's getting so big. Lily, what was your favorite part of the day? And you know what? Now our kids are 8 and 10. We do this every single night. What is your favorite part of the day? What are you thankful for today? Guess what's running in their mind all night long? Positives. Now my son, Miles, Daddy, what's your favorite part of the day? Right? And they're asking it back. So guess what my wife and I get to do every single night? Is end the night on a positive note. Right? So if you can do something that's going to help minimize the emotional and mental stress in your life, number one, shut out the news. You're going to be aware enough when bad stuff happens. It's impossible to avoid it. But you don't have to inundate yourself with it all the time. Because the more you focus on it, the more it perpetuates the stress and the negativity. Now, chemical toxicity. Man, this one's a tough one. It takes work. There's no way around it. The obvious ones are out there. Yeah, smoking's bad for you. So, analogy, all right? Smoking and scar tissue buildup when the joints sprain. One little fall might not be the end of you. One little cigarette might not be the end of you. But see, accumulation and the next one and the next one and the next one and the next one and the next one, excuse me, that eventually break you down. Okay? So the obvious ones, cigarettes, drinking to excess, drugs, medications, well, medications are drugs. Anybody want to go down to Tannery Bay and jump in and grab a gallon of water and start drinking it? I don't. And I know they've done a whole lot down there to clean it up. I still don't want to go down there and drink all the water out of Tannery Bay or out of Blueberry Ridge. Right? That stuff's going to be around for generations and generations and generations until nature can clean itself. See, so avoid the obvious chemical toxins. But what about the ones that aren't so obvious? What about our diet? Okay? I saw the eye roll, Brian. And this doesn't mean that you have, I mean, obviously I like to eat some good foods. But it means be smart. We all know what's junk. Hey man, the apple's better than the chips. We all know that. So eat more of the apples and less of the chips. One of the things that I think really screwed up generations nutritionally is when they came up with the food pyramid. Because right at the bottom of the food pyramid, they have grains, breads, rices. Eat all your wheats. Eat bunches of them. See, it's the worst thing you can do because sugar is one of the toxins that affects our body the most. And when you eat a bunch of breads and you eat a bunch of pastas and too much rices, those sorts of things, grains, the minute that digests in our system, it turns to sugar. When we have sugar in our system to excess, it leads to inflammation. And every time there's systemic inflammation, there's disease. There's heart diseases, there's cancers, there's ulcers, there's name it. Right? And they perpetuated that myth for a couple of decades. So a few generations are damaged by that. The reality is, you should be eating 10 to 20 servings of fruits, vegetables, and berries a day. Right? Even before the food pyramid, I grew up on 4-4-3-2. Okay? You eat way more than 4 servings of fruits and vegetables. You eat 10 to 20, because when you're eating the 10 to 20 servings of fruits and vegetables every day, what's happening is that creates alkalinity. That fights inflammation, that keeps inflammation down in our body. And when we have lower inflammation in our body, now there's less disease, there's less sickness. So our bodies lose weight. Disease can't live in an alkaline environment, and that's what those foods do. So fight the chemical toxicity. Again, people get mad at me for this, and I know some medications are good. I mean, I understand short term they can save a life, but you got to understand when you're on drugs and medications for long term, just watch a drug commercial, right? And they only tell you like the top 10 side effects on a drug commercial. If you go to the websites and you start reading down all the way through, see, I don't believe in side effects. Classical philosophy, physics, it's the law of cause and effect. So if you take an aspirin for a headache, it might help your headache, but if that aspirin causes your stomach to bleed, the effect of that aspirin is causing an ulcer. It's not a side effect. It's how we try to minimize it. The United States spends more money on pharmaceutical drugs every single year than any other nation in the world. And what happened, and reality is, we are the least healthy country of all industrialized nations. Right? Now, if we take the most drugs, shouldn't we be the healthiest? That's what they want you to believe. You just take as few of those as possible. Because if you're doing the things elsewhere in your life, with your diet, with your activity level, getting adjusted, man, I got people that are 70, 80 years old in here. There are no medications, or maybe one. The average senior citizen's on 7 or 8. Give me the best biochemist in the world when there's 200 trillion cells in your body with 100,000 chemical reactions going on at every given moment in time in every single one of those cells, and you start introducing 7 or 8 or 10 different drugs and medications. The best biochemist in the world, it's going to take them 25 years to figure out how all those interactions are happening in you. And they don't test that for every single person. They say, well, as a general rule of thumb, we're going to give this drug to 100 people, and if 4 of them die, that's what it is. Be careful with that stuff. Properly prescribed prescription medications kill more people every year. 150, 200,000 people every year. All illegal drugs, coke, meth, heroin, they'll kill between 10 and 20,000 people. So you gotta be, like I said, drugs are drugs are drugs. Limit and minimize, because that chemical toxicity is going to affect the way your brain and nerve system work and function. Right, we had kind of already covered this. What does subluxation result in? Regardless of what causes it, a fall, an accident, absolutely can cause pain. And I know that majority of people, they come in here, they see chiropractor, and our profession has done a fabulous crappy job of, over the last 50 years, painting us into a low back pain box. Listen, every study ever done has shown chiropractic is the safest, the most effective, and the most cost-effective way to deal with musculoskeletal pain. So yeah, I understand why people really try to put us right into that little box there. And we can help with it. It's safer than drugs, it's safer than surgery, and it's more effective than either of them. But if, like I said, little girls who, how old can I, yeah, I mean, so this lady's sister, I started seeing her when she was 2.5 years old. And up to that point, she had been on antibiotics more days of her life for ear infections than she had not been on them. I think it already had 3 sets of tubes, and they're getting ready to do a 4th set, and lost about 75% of the hearing in her ears. Right? And all she had was subluxation up here in the upper neck. Top bone, those nerves that go to the ears. We started working on them, started working on them. Because, when those nerves weren't working, the ears weren't working, viruses could attack the ears, create redness, create drainage, create more sickness. And all we did was start working on that area. I still remember she called me Dr. Click Click, because the only way I could adjust her was with the activator, right? Not used very often, but I did with her. As we started working on her, ear infections got less. And I remember exactly your mom's words. She comes in, she goes, okay, Dr. Brent, I gotta ask you. By the time we get home, and they lived over in Hesperia, by the time we get home after an adjustment, there's ooze coming out of her ears. I'm like, great! Her body's finally getting rid of the junk. So as we start correcting the nerve interference, as we start getting those joints moving and the pressure off those nerves, and the brain can talk to the ear better, the ears work better, the ears got rid of the junk. Coolest thing, I tell this story all the time, her hearing came back. The doctors were saying that they start teaching her sign language. She's not going to be able to hear when she's older. Now she might not listen, but right, the body's ability to heal is amazing. I've seen some of the worst case scenarios. I saw a woman who, when she got out of the Army at 22 years old, she got married, got pregnant, had a baby, difficult delivery, they used forceps, they pull on her son's head, and they broke her tailbone, her coccyx. That tiny little piece right there, broke it. And in their wisdom, they took it out. Now that is where, that's part of the spine, the very tip end, where the terminal ends of the spinal cord attach into. I don't know what happens with that. Never really figured that out. All I know is as a result, Beth was in such pain over the next 5 years that they did laminectomies on L3, 4, and 5, which means they took this part of the bone and broke them off. Trying to relieve the pressure around the spinal cord. By that point, you know, nothing worked. She was on 125 milligrams of morphine a day. She was on, and I mean, on top of the Tylenol and aspirin and everything, right? This girl, and because, you know, those drugs depress you, they bring you down. This girl, they gave her uppers, they gave her Adderall, they gave her these drugs to bring her out of the depression. She was shaking, she didn't know which way was up. Her nervous twitch was picking at her skin, and every open piece of her face, open lesions that were oozing, right? And I'm sitting there and I'm looking at her, I'm going, I literally had to compose myself. What am I gonna do with this? Same thing I do with you, same thing we do with every single person. Find the areas, Brent. Find the areas you can work on. And we did. Started working on her, Got in 3 months. She was doing a little bit better. Got in 6 months. She goes, hey, Dr. Brent, guess what? I was able to do 9 loads of laundry this weekend. I'm like, great, come do mine. Right? Those of you guys that get to know me, I mean, right, I just get goofy. But at that point, I just had a good relationship with her. And we start working, and she goes, no, you don't understand. My laundry's in the basement, and it's down a steep set of stairs, and I haven't been able to go down and lift the laundry basket down there for the last 2 years. So to her, that's the biggest thing in the world. By the time we got done, all the heals, all the oozing wounds were healing. She wasn't shaking. She was down off the morphine. I mean, she was still on medication, pain medication, but way less, right? I remember the day she comes into my office, she goes, Dr. Brent, I just got to tell you something. The day before I came in and saw you, I had a gun in my mouth ready to kill, ready to end it, right? Why do I tell you that? Because I've seen every bit of it. I've seen how that physical damage can affect the mind, affect the emotions, affect actions. And I've seen how correcting it can help them improve. And that's why we are how we are here. Listen, I get that our office is different than most. I get that it's upbeat and lively, and you're never going to see me in a white coat. If you do, I hit my head and have a closed head injury or something. All right? But all that fluff, it's fluff, it's fun, it's who we are. But it's getting the results that we get because we help the body heal itself. It's what drives all of us every single day in our office. It's what drives us to help, because we know healthier people in this world don't do as many bad things. So you see this? That's our vision statement, healthier people, healthier planet. I know we can't control I can't control anybody's actions. I can't control my 8-year-old. I can tell him the expectations of behavior that I want. Can't control him. No one can control anybody else. But if we can help people improve health, if we can help people reach more optimum levels where you're feeling better, it's going to help you function better and think more clearly. I truly believe, and we'll have this debate with anybody, healthy people who are well adjusted and not on medications and their brains are working well don't go out and shoot up churches. They don't shoot up Walmarts. But you know, one common theme, all of those mass shootings, those kids, as children or adults, were on some level of psychotropic drugs. Ritalin, Concerta, Adderall, any of the anxiety drugs, they affect brain chemistry. It's not healthy. One person at a time, if we can help people be healthier and make better decisions, then our little community is a little bit better place. That's all we try to do. We try to have fun while we do it. All right. So, what do we do here? So here's practical, right? Why do people come in? When they come in, their back hurts. We start them on initial care, initial intensive care, pain-based care, whatever you want to call it. This is designed to help people feel better, heal better, as quickly as possible. Now, we start out with people 12 weeks, all right? None of this is random, guys. Everything we do has purpose. Everything is clinically or scientifically based. Why 12 weeks? Because the ligaments and muscles that hold these bones together, when they're sprained, and these are the same types of joints as like an ankle joint. So if you're ever sprained an ankle, and those ligaments are damaged, it can take 3 to 6 months for those ligaments and muscles to heal properly. That's if you sprained it yesterday. Now, what did I say? The average age of somebody coming to a chiropractor for the first time is 45 years old. So I'm dealing a lot of times with people that have more damage. Still, 12 weeks is a fair amount of time. We should have a pretty darn good idea of how you're coming along within that time frame. All right, it's not random, it's systematic. Why do we start people out at 3 times a week? Because I think it's unrealistic for people to come in here 7 days a week. People are too busy, they're not going to do it. All right, that being said, the more we see you in the early going, the faster we get you off the ledge, so to speak. Now, 3 times a week, I give you an adjustment, you're sitting like this, we know that joint's going to move better for anywhere from a couple hours to a couple of days. So we like to be within that 48 to 72 hour window so that we can make long-term change. Now, I've had people in here like this, and if I say, hey, come in 3 times a week, by the time I get to the 3rd visit, they're saying, man, I feel nothing, I'm out of here. So what do I do for those people? I say, hey, come in the morning, come in the afternoon. Hey, come in here, bring a book, sit over here in that room, and I might adjust you 5 or 6 times in a day to speed up that process. And I didn't learn that early. We don't learn that at school. I know all of you get a folder that has, hey, we're the Beacoms, and this is my son Miles' story. And my son Miles had what they call speech apraxia, and it's a brain disorder where the brain can't talk to the vocal cord muscles, and he didn't start talking until he was almost 5. He might have mimicked dad, but he didn't start saying words and sentences for a long time. My wife took him up to Toronto, Ontario to see Dr. Roger Turner, who developed a cranial bone technique. She took him up there and said, hey, I don't know this stuff, help my son. And he was almost 2. He wasn't walking yet, wasn't even cruising along furniture at this point. You gotta understand, that's kind of hard for 2 chiropractors who try to think that we do most things pretty well, right? Dr. Turner saw Miles 5, 6, 7 times a day for 3 straight days. And at the end of that week, I met my wife in Detroit for a seminar. I watched my son take his first steps to me, and yeah, I mean, it was so cool. But I sat there, and what Dr. Turner had told my wife was, if I have you here and you're coming all this way, I'm going to do as much as I can in a shorter period of time as possible. I don't know, I was such a dummy and it took me so long to figure that out myself. But now, I don't care if it's morning and afternoon, 5 times a day, 3 times a week. 3 times a week is realistic for most people. But we're going to do what's necessary for each individual to get them past that first process. All right? Now, once we get you past the edge, oh man, I can walk again. I can sit for a while. I can watch a movie. I can go fishing. I can do. You're out of significant pain. When we get to that 12-week time frame, now we reevaluate. We check and see how the tissues are healing. Now's decision time. And this is where everybody has to make this choice. I'll tell you what I think is best is continue building on what you got. All right? Because if you start here and you get to this point, that's the tip of the iceberg, fellas, ladies and gentlemen. In the lighthouse room, you'll see a poster, and it's kind of got a little roller coaster going down. People do all those little dots, mean a visit, and they get you to this point. But if you're an adult and you come to our office and you're already in that phase 2 level of degeneration, which most adults are, it can take you 20, 30, 40, 50 years to get to that point following an injury. It can take a year, 2, 3 years to fully stabilize it. And that's just cold, hard facts, and nobody wants to hear it because no one, I don't want to do this forever. Well, then don't. And if you don't, and we get you here and you're happy with how you're feeling, then write it out. But eventually, if you don't keep things moving, your body's going to fall off the cliff again. You're going to come back, God, it hurts worse than ever. Hey, we're right back to that point, and we'll start the process again. And that's what I call the roller coaster of care. And that's how we're taught to go to medical doctors. That's how people are taught to take care of their bodies, and I'm here to tell you, yeah, it's a way. I do not believe it's the best way to take care of your body, because every time you fall off that cliff again, it's harder to climb back up, and you never get as far. And so you're constantly in a downward slide until at one point we really can't get you back up, or not to an acceptable level. So when you get feeling better and the symptoms are subsided Now you got to think about allowing all those tissues to heal and stabilize over the course of months to years. I wish we could do it with a wave of Harry Potter's wand, but that's not what happens. When we get to reconstructive care and rehabilitative care, yeah, we don't need to see you 3 times a week at that point. I mean, hopefully we're past that by the time we get to the 12 weeks, but at that point, it's usually a couple times a week, and I like to stay there for a while, 6 months, a year, and keeping people moving in the right direction and stabilizing the spine. Now, ideally, we get you to a point where we can get you in here once a week, and once a week, right, not once a month. I'd like to go back in time and find the guy that said, yeah, you can come see me once a month. There's no clinical science anywhere that says that's appropriate. Why we base weekly is the scar tissue. Scar tissue starts building within a week, 7 to 10 days after a joint gets stuck. Well, then we want to see you within that time frame, because when we can stop, or at minimum slow down, most of the time stop the progression of the degeneration and arthritic damage. And that's why we recommend the ongoing care. Listen, it's not for us, it's for you guys. I've run into it a lot. Well, you know, I don't want to keep coming forever, then don't. How long have you been on that blood pressure medication? 20 years? Don't you think you've had enough of it by now? See, it's a double standard. It's a double-edged sword. People will speak on one side of their mouth and say, well, I have to have these medications. The other side of the mouth, they don't want to take care of their bodies with proper diet, exercise, and chiropractic care. You want, right? No one's going to help your body get stronger and healthier but you and the choices you make. So when we lay out these recommendations, rest assured, they're backed by science. This isn't random. This is the best way to stabilize and get your body stronger moving forward. Pain or no pain. And it's really cool because, 19 years ago when I was starting and I was telling people these stories that, weekly about everything I just told you, I was hoping it worked. Now here I am 19 years later, and I'm fortunate enough to have a lot of those early patients. And we do take pictures every couple of years to manage and monitor people's spines. Because clinically, I'm never going to do anything that's not clinically appropriate. And it's clinically appropriate to stay up to date on this stuff. And I have my 15th patient ever who still comes in. And she comes in and her x-rays of her neck, they look about the same as they did when she started 19 years ago. Awesome. It hasn't gotten any worse. And that's what we go for. All right? Now, but Dr. Brent, my insurance only covers. Listen, if you got insurance, awesome. I will tell you right now, I am not a fan of insurance. I know it's a reality in our world, but it is very limited. 30, 40 years ago, yeah, it was unlimited. Guess what? Insurance companies, they're only interested in keeping their money. All right? But if you have insurance, we'll gladly bill it for you. Understand, it's not my policies, it's their policies. Whatever they cover, they cover. Usually there's a visit limit. Usually there's a deductible that has to be met. Usually there's a copay. All right? That stuff's your responsibility. Now we'll work with you. We've got payment plans. We can work on payments. Always will work with people. But you got to understand, insurance is designed to take care of one thing, and that's initial intensive care. It's really not designed to take care of these. Okay? And insurance companies know the deal. Everything I just told you, they give people, I mean, it varies, but a lot of policies are 20, 30 visits a year. Guess what? 3 times a week for 6, 8 weeks, get people out of pain, symptom-based. That's what insurance is designed to do. If you're fortunate enough to have insurance that covers a few more visits and they keep covering it, great. I got no problem. All I'm ever going to bill out to insurance is your exam, your x-rays, your adjustments, and if you're lucky enough to have massage therapy, we do have a massage therapist on staff. That's it. I'm not going to get into therapies. I'm not going to try to bill your insurance for all they're worth. I don't want to get into any of that. We want to focus on what we do. Now, insurance, let's say it gets you through your initial care. Fuck, I can't afford $40 a visit for the rest of my life. No, I understand that. I couldn't either. But that's one of the purposes of coming tonight. Is it makes you eligible for our wellness care structure, and I'll get into that in a little bit. Because if what I'm saying makes sense to people, and you want ongoing care, you want it to be affordable. Has everybody been here when they've seen the family of 10 come in? You have, Brian, right? I have a family of 10. They're awesome people. If I didn't have ways to help them afford it, they wouldn't be here. And yet the policies we apply to them are the same policies we apply to everybody else. They don't get any special treatment, right? It just works for their family with our wellness structure. And basically it's a monthly wellness fee. For a set fee, you come in when we tell you to come in. And it's always going to be telling you to come in bare minimum once a week, right? So that we can keep you on a well basis. But if you're in reconstructive care and we need to see you a couple extra times, if we tell you to be here, be here. It covers it. If you fall off a cliff or you get in an accident and you go back into an initial intensive care state, well, then we'll put you back on insurance for that process, right? There's rules I kind of have to follow, but we're going to do it with your guys' best interest in mind. All right? Cash patients, listen, about 65, a year after year. Look at my statistics at the end of the year, 65% of what we make in this office, it comes out of your guys' pocket, right? Not insurance anyway. So a lot of people come in here and they're cash based. So we have cash plans and we have payment plans and we work with people. So never let, what I say, stress is one of the things that causes their body not to be healthy. Number one cause of stress in just about everybody's life is money. Number one cause of divorce, number one cause, finances. How stupid of me would it be if I have policies in place that make it more stressful for you to be here? That would suck. So we have systems in place to try to alleviate that stress. Yeah, I'll get paid down the road, I'm okay with that. But we set it up so that you can get the best care possible, get you past your crisis, but then also get your body, keep your body working well. And this right here, whatever you choose is up to you. Anybody who's ever been with me, I've always said, I'll give you heads, I'll give you tails. All right? I'm here to adjust you. And if somebody chooses what we recommend and says, yes, this is what I've been looking for, and I want ongoing lifetime care for me and my family to stay well, awesome. And if I get somebody who says, you know what, Doc, I'm only going to come in, I'll be honest with you, I'm only going to come in when my back really hurts and I just want a couple visits and just want the edge off. I'm going to give this person the same exact adjustment I give that person. Correct, accurate, specific, loving, and kind. It's all I know how to do. All right? So that's your guys' choice. I'll never beat you over the head with your choices, but understand, if we go through this, every time we get you back to this point, I'm going to look you right in the eye. I'm going to say, you want to go forward with this at this point. You're feeling better, you're doing good. It's my recommendation that we start seeing you once a week. And you're either going to do it or you're not. But I'm always going to leave that door open for you guys to make that choice. So, pharmaceutical companies spend more money every year on advertising their product than they do on research and development. We can't do that, so I talk a lot about it, and Dr. Nate talks about what we can do, and my wife talks about it, and all we do is talk to you guys. That's our job, is teach, educate, try to get you to understand a little bit better why we do what we do. Your guys' job, be here. Be here for the visits that are recommended, because if you want the results, if you want your body to function at its best, pain, no pain symptoms or no symptoms, be here, because we're going to set it up properly for you. And tell others. If there's somebody you know that is struggling, somebody that has a health issue, I don't care if they think it's their back or not. If anything you learn tonight, please understand, don't limit it to that. I mean, if there's somebody who's got a health issue, have them come in. Because they might think it's their lungs and we find something in their spine and they breathe better. You know, I mean, evaluate it. Because when they come in here, they're going to go through just what you guys did. We're going to go through, we're going to show you your exam, we're going to show you your x-rays, and decide what you want to do. But share your experiences of chiropractic with others. Because you never know how far reaching something you may think, say, or do for someone today will affect them tomorrow. Right? And so please, 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 please. You know, tell people, come here, come learn. This doesn't cost a dime. Come in here, listen to what we have going on. If it makes sense to them, they can sign up. If not, great, thanks for your time. Hopefully you're a little more knowledgeable about your health. All right, so winding it up here. General questions about chiropractic, about what we do here in the office. What's an adjustment? Getting a little stuck bone moving like we talked about. There's many different styles, techniques, and ways to do that. Do they feel good? Not all the time. I get it. There's times I hurt. I mean, just this past winter, I really hurt my shoulder, and there were times Dr. Nate went to adjust me, and I really didn't like him when he did it. I mean, it hurt. But he allowed it to help heal better. It feels better now. All right. No, you can't adjust yourself. I mean, I can do this, and I can make noise in my neck, but all the noise is gas. Right? You get a ligament capsule around there, and it encloses the system, and there's fluids and gases in there, and you know it's stuck, and boom, we move it, those gases explode, and that's where the pop, pop, pop comes from. Doc, you got a bunch of them. Well, really, there's like on each bone like 8 joints, so you know, might just move one bone. It's just every joint on that bone moves. But when you see people doing that, listen, that subluxated and stuck joint is still stuck. It's the one above and below that's rubbing on that stuck one that's making the noise. And yeah, your body might release some endorphins. You might feel better for this long, but guess what? 15 minutes later, it hurts again. It's because you didn't move the stuck bone. So you're not getting, I get it. I mean, I've had the patient who said, "You'll never believe it, Dr. Brent. I know we've been dealing with this low back pain for weeks, and I fell down like 3 stairs going outside, and when I landed, pain was gone." I'm like, that's awesome. I'll bet you can't reproduce it. It's just you can't do it over and over again. Yeah, I know that happens, but the reality is, no, you're not getting a whole lot done on yourself with adjustments. I already covered frequency, noise. Don't adjust other people without knowing what's going on their spine. For the love of God, don't let people step and walk all over your back. And I was guilty of this in high school. Jason Cronemeyer was our 6'4" power forward on the basketball team. We're like, "Hey, Crony, pick me up." Right? Here's why. And this also answers, you know, why we have our office procedures. My 9th patient I ever had in the office. I met him at a business meeting, and he's like, "Hey, okay, I'll give you a chance, Brent. I have a little neck stiffness." And he comes in, and I wasn't here. I was across the road in my first office, and I didn't have any staff, and it was just me. And I'm sitting there, and he goes, "Listen, I know you're new." He said this. "I know you don't really know what you're doing, and you don't even have to bill my insurance. Just, you know, here, I'll pay you cash for my adjustments. I just don't want to go through the whole X-ray thing." "Gary, you know, if I don't take X-rays, I don't know what's going on in your spine. My knees are knocking. I don't know if my voice was shaking or not." It's like, "But if I don't know what's going on, I wouldn't feel comfortable. So if that's the case, let's just not start." I don't know where I came up with the guts to say that, because the reality is, in my 9th patient, I really needed to keep my electricity on. I needed the patience, but I knew that I couldn't comfortably take care of him. So he let me take an X-ray, and he had a broken bone in his neck. Taught me a lesson that I will never forget, and here I am 19 years later, and we're on file 5600 something 100. I will not break from my policy. Our procedure is there for safety, and make sure we know exactly what we're working on and what we're dealing with so that we can take the proper care of you. All the fluff, man. We have so much fun here, and I know Harvey jumps up on you guys. Sorry about that. Kids running around the hallways. I love it because it's energy that keeps me going every single day. But clinically, I will never cut a corner because it's not safe, and I know the minute I do, I'm going to get smacked in the face with it. So, even I've been questioned on, "Why do I got to take X-rays? I just took them 2 years ago." Just recently, we had a teenage girl who I've been taking care of since she was a little kid come in, and she was just on a routine X-ray, and we saw right there, top part of her back, lower part of her neck, top part of her back, something that wasn't there 2 years before. And it's a silent tumor that would have grown for probably another decade before she felt it. In fact, they went to Children's Hospital, and they're like, "How'd you guys find this?" Like, "Oh, our chiropractor took an X-ray." Right? So, even if nothing changes structurally with your spine, I'm good with that, especially as adults. Kids, you almost always will see some sort of change. But with adults, I will be happy The rest of your life, Brian, if Dr. Nate can say, yep, Brian, hey, I know you're feeling better and functioning better, and you've been coming in here for 10 years, and your spine looks just like it did 10 years ago. Let's keep going. No, I mean, degeneration isn't going away, but as long as it doesn't get worse, we're winning. Okay, and that's why we run our office policy. Now, things you can do, I kind of mentioned it earlier, physically for yourself. This is the nuts and bolts. This is stuff that you guys can take home and go home with. You know, like I said, stay on schedule, get your adjustments, do what you got to do to keep the joints moving. That's bare minimum. Other things physically, exercise. Now, that doesn't mean you got to go to the gym for 4 hours a day, but do something, move. Again, motion is life. Go for a walk 3 to 4 times a week. Now, it's not a walk. Let's get your arms going. I don't care if it's just down to the side, the stop sign and back. I don't care if it's around the block. I don't care if it's 5 miles. Do something every day that you're getting your heart rate raised up. Get you moving. Your shoulders are back. It helps your posture. It's the other thing. Don't do this. And I'm guilty. These guys will tell you, I like being on my phone a little bit. But try to keep it out in front of you. Try to keep your shoulders back. Don't be in this posture all the time. Okay? Those are things physically that you can do. If you want me to sit down and set up 3 or 4 stretches or strengthening exercise for you, I'll gladly do that. But anything I ever give you is going to be based on yoga. Anything a physical therapist or a doctor gives you is based off of yoga. So just do some stretches or find a gentle yoga DVD to do. Physically, that's what you can do for yourself. Mentally, I kind of covered that. Find a meditative time. Change your routine and your affirmations. Every day for the last 15 years, I've been saying an affirmation. Today's a great day, and I have the opportunity to show up as the best me ever. I'm an irresistible magnet with the absolute power to attract in my life everything that I desire. My life is a huge success. I'm committed to constant nevering, blah, 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 blah. And that's like 5 paragraphs I say every single day. I have it put on my pegboard. And when I started saying that stuff 15 years ago, I didn't believe half of it. But the mind doesn't know the difference between what's real and what we think about. So you might as well put good stuff into your mind. Right? Chemically, listen, something I've been adding into our office, and do this or don't do it, again, I don't care, it may not be for you, but look at your diet. Like I said, if you want to do something for yourself, increase fruits, vegetables, and berries in your life. They help reduce inflammation in the body, and every disease process is based off of inflammation. The product I started taking is called Juice Plus. It's not specialized supplementation, it's simply whole foods. Okay? There's a time and place for proper nutritional protocol, and we have a naturopath that we work with and refer people to, and doing that is great, and they do it right, and they do blood tests and hair tests, and they do things to find out what's specific to everybody. And if you need that, awesome, but I would always say, start simple. And if it interests you, all Juice Plus is food that's growing toxic-free, chemical-free, that's dehydrated down into little capsules, and then you take them, and it bridges the gap between the 4, 5, 6, 7 servings of fruits and vegetables that most Americans are getting, and the 10, 15, 20 that we're supposed to be getting. And it gets all those phytonutrients into our cellular structure, making our cells stronger. Again, it's not a fix-all, but God bless it. If you're not getting that minimum, your body is not going to work well, or as well as it can. And it's going to be, can be more chemically toxic. The thing that convinced me on this, I have a woman, fibromyalgia patient, chronic pain, been here for like 8 or 10 years. And we got her back to where she functions pretty well. But she was de-gutted, essentially. I mean, they cut out part of her stomach, a foot of her colon, part of her small intestine, her gallbladder's gone. And they did surgeries that just took out most of her digestive tract. She cannot get the nutrition out of her food the way she should. It's just physically impossible. And so she was always dragging, always kind of down, always kind of hurting. And I said, Vicki, I'm just starting to take this. Would you try this for 4 months? Just 4 months. Give this a shot. And she took it for a month. And I remember she comes in here, she goes, it can't be that simple. I'm like, I don't know what you're talking about. What are you talking about? It can't be that simple. She goes, I've been taking this product for a month. And I had more energy and I was feeling better. I was able to do more things. She goes, then we went up north and I forgot to take it with me. And I didn't take it for 3 or 4 days. I started feeling like garbage again. I came back and I started taking it again and I felt better. I'm like, Vicki, because you're getting the nutrients that your body needs. And I looked at her and I said, okay, that woman's missing like most of her digestive tract. It's a good product to help bridge the gap. If you're always inflamed, these are chronically tired. If you're chronically tired people, if you've got chronic aches and pains, that indicates inflammation. And I'll almost always be able to pinpoint it. If we got the joints moving and everything, be able to pinpoint it on diet. So if you're interested, talk to me. If not, great. If at any point you want more answers, please ask me. All right. Thank you. Listen, I know all you guys are already patients. Why do I have you come here? Like I said, yeah, now you can be eligible to be on our wellness structure if it makes sense to you to move forward, okay? But also so you have a better idea, because I get when you come in to see us and we ramble and we don't, this is what we do as chiropractors, and we give all this information, you don't care. You'd be standing up better. Our minds are so full of pain. All you want to do is feel better. So I get at that first part, it's hard to hear everything we have to say. But now that you have a little bit better idea, still ask questions if you have them, but take this information out, and when you see somebody who's having a health challenge, give them our card and say, here, just go see what they can do for you. Right now is a perfect time, the next 3 weeks, 2 weeks, until the end of August. We're doing our school supply drive, and we've done this for over a decade, and we love it. And all the products go to Whitehall and Montague elementary schools. You can either fill a backpack, or if you don't want to go shopping, and this is what you can tell all your friends, $50 donation, and I go maximize that money and get as much stuff as I can. And it's great. It changes kids' lives when they can walk out with a new backpack, or the teachers don't have to go out and buy wipes for their classroom or tissues. It really makes a difference in our community. So over the next few weeks, if you know somebody that could benefit from what we have to do, or what we do here, that's the best way to get in, most cost-effective way for them to start. So if you have any questions, I'll stick around for a couple minutes. Otherwise, thank you guys all for coming, and go enjoy your evening. Thanks.